career insight, industry expertise, and professional development. This is the Career Gurus Podcast, your premier source for helping you navigate into a new career. Hosted by Daniel and Matthew. Podcasts are uploaded weekly on all platforms, so make sure you're subscribed.
Awesome. Episode 2. Here we are. Hey, Daniel, how you doing?
Hey, Matt. Thanks for taking the time today, Thomas.
Appreciate you guys having me on the podcast. Thank you.
No problem. Yeah. Thomas, tell us a little bit about what you do and personally and for your career.
So I guess let's just kind of start with the basics. My first name is Thomas. I live here in Ontario, Canada, and I am a registered cardiovascular technologist. So I see a lot of the cardiac patients that, either come in with post-stress, whether it be, heart attacks or having a bypass or coronary artery disease. And we essentially try to get them back to a healthier life.
Very cool.
That's awesome. I'd like to follow up on that a little bit, Thomas. So do you work in a hospital setting or a private clinic for our viewers who don't really know what's involved in your line of work?
Yeah, for sure. So I've actually worked mainly only in a clinical setting in all of my career. I did start off working as a cardiac rehab supervisor in a different city for about 3 years. So to kind of touch on that a little bit, I spent a lot of, one-on-one time or even in a group setting with patients, kind of educating them on the importance of their heart health. A big key, was, prevention and therapy. So that entailed, aerobic exercises, and then giving them the tools that they can use to actually do things to better themselves, at home. And then now currently at my job, again, I also work at a multidisciplinary clinic where we have, a nuclear department, the cardiac department, respiratory department. So these patients do get a big streamline of care, whether they come in for, all these aspects of their life or just one.
All right. Yeah, that's awesome. I guess wanted to jump into your time as a rehab supervisor and maybe in your experience or what you've observed. How important is, the basics, exercise, sleep, diet, sufficient water, in terms of your overall heart health, and what can you do to improve your overall heart health, whether you're young, middle-aged or getting up there?
So that's actually a great question. In my time working there as the supervisor, the biggest key takeaway that I can give, a lot of patients or even just everyday listeners like ourselves is, being sedentary is probably one of the worst things that you can do. So, you've heard the expression "sitting is the new smoking." Well, there is so much truth and merit to that. The big takeaway is just you have to understand what you put into your body, obviously how stress can affect your body, your hormones, and things like eating properly. Getting moderate to light exercise, 30 minutes a day, 5 times a week. It doesn't even have to be something that's necessarily like a structured gym routine or setting, and just educating yourself on even some of the warning signs that, may arise for us as males. Research shows that once you hit the age of 45, your chances of coronary artery disease start to increase. And then on the flip side, for women, that's the age of 55. So, family history plays into it. Having the certain genetic backgrounds is also another predecessor. So the largest component is actually educating yourself.
I could totally understand that. I mean, stuff like that, it's so easy for us to think that why doesn't everyone else get this, right? But at the same time, like we spent years studying what we know in order to be good at it. And whereas other people really don't give a second thought to it, right? So kind of leading into that, how did your education tell us about your educational background? Like, how did it get you to where you are now?
So I actually started off my post-secondary career in the nursing program. I figured that was a route that would be the best for me, but about a year into the program, I realized that it was quite emotionally taxing, just in the sense of dealing with, patients that may be on a cancer ward or sort of on their last breath, if you will. So I went back to school, picked up some grades, and realized that the cardiac field is actually very interesting. And you did have to write what they call the HOA entrance exam, which is about 2,000 applicants a year, and you only have about 30 spots into the program. And I was fortunate enough to complete that examination and then finally land a spot in this program.
Would you see yourself kind of going into other disciplines within the medical field, or staying particularly in cardiovascular?
I have thought about maybe diving into the cath lab. So for those who don't know, cardiac catheterization is basically going in to assess the blockages or the severity of one patient's blockages to determine, what the next outcome or treatment plan would be. So whether it be just medical therapy or medical management, doing invasive procedures like placing stents. So I would like to, at some point in the career, maybe dive into working in the cath lab.
Now, does the current spot where you're at right now allow for those options to take place, or is there further education that you would need in order to dive into those different fields?
Yeah, so you would need to have some further education. I believe it's a year and a half. As well as completing your education, you do need to kind of have your foot in the door. So whether that being knowing the team that works in the cath lab, the cardiologist, the nurses, the anesthesiologist. So it's a bit of give and take in terms of education and also knowing the right person to get you into that door.
Okay, that makes a lot of sense, right? So would you see that there's a lot of like apprenticeships that go on, or is it really just consistently trying to find the right person to bother for you to get your foot in the door?
Yeah, I mean, it's hard to say that anyone in the medical background or whatever type of education you have can do what I do per se, but it is quite a niche in the sense that you have to have some particular skills or education to move on to that next step in your career. You can't just have let's say a nuclear tech come in and work in the cath lab. It's a totally different realm in that sense.
Okay, that's completely understandable. Now, is there ongoing education that's needed for your field?
There is. So in our cardiac organization, if you will, it's called the CSCT, or Canadian Society of Cardiovascular Technologists. You are required to get 30 educational points every 3 years, and you can keep that up by going to certain seminars, whether that be held in in Ottawa or Montreal. You're also able to educate yourself on current medication updates, or whether it be new procedures through online sermons or webinars, such as using the Heart and Stroke, which is one of the leading sites for continuing education.
Okay. I think it's as someone who's spent some time of his career being myself in healthcare, I've seen a lot of different avenues, and I can definitely understand from when you speak to the seeing the worst of what life can throw at some people, especially in the ICU. I'm curious if you could tell the listeners what your day-to-day looks like.
That's a great question, Matt. So coming in, the first thing that we would do is, obviously, a lot of these patients are brand new to us. Some of them are coming to continue their care or therapy, but most of it would start with the consultation aspect. So sitting down, understanding why the patient is coming in, what the reason for the referral was.
Mm-hmm.
Are they coming in with any risk factors? Are they coming in because they have family history, or they're more, susceptible to, blockages or hypertension or diabetes? Another aspect too that we've been seeing more commonly in the last, 6 to 8 months is post-vaccine. So a lot of our younger male patients, in particular, between the ages of 20 and 35, are coming in with myo or pericarditis. So there's no such thing as a linear day. You can come in and have a very complex patient. You can have a patient just coming in for the sake of having small minor symptoms like palpitations or racing of their heart. So it encompasses consultation and then testing, and then finally the diagnosis given by the cardiologist.
Would you say that a percentage of your work week is dedicated to ongoing consultation? So patients that have gone through the system and gone through the process, are you continuing to coach them as they recover and heal from their operations?
Right. So, I would say 60% of the patients that I do see on a daily basis are brand new patients, and then the other 40 are coming in, whether it be every 6 months or yearly. And the focus has always been education. You can always throw medication on someone's plate, if you will, but understanding why you take this particular drug, or why it's important to follow up with monitoring your blood pressure at home, or your blood sugar, or having adequate exercise in your life, reducing your stress. It's one thing just to be told what to do, but then there's a reason why you should be doing these important things. So education is constantly ongoing in the sense of, you taking care of these patients.
Yeah, that's very interesting. I'd like to go back a few minutes and dive a little bit more into your educational background. Maybe talk to us how long the program was. Did you have to complete any clerkship or internship placements, things along that line? And maybe even once you've graduated, is there a designation or a medical license or exam that you have to write in order to become registered?
Yeah, that's a great question, Daniel. So the program that I took was 2 years in length, and that does entail obviously a big educational component, whether it be through textbooks or just in-class webinars. But you do get the opportunity to have what they call clinical placements. So in total, it was about 8 weeks. Your first year was a little bit shorter in duration, that being 4 weeks, and then your second year, you actually get to choose whether you dive into the hospital setting or a clinical setting. So I was fortunate enough to work in Sarnia, Ontario, Cambridge, Ontario, as well as Kitchener, Ontario for all 3 of my rotations. And I did find that for me personally, the clinical setting was still enough of a challenging aspect, but not as physically demanding as, let's say, the hospital setting, where, as you touched base briefly, Matt, the ICU can be, very physically taxing, emotionally taxing, draining, all those aspects.
Oh, absolutely. Yeah.
And then to follow up on your last question there, Daniel, once the graduates do complete their 2-year program, you are required to pass what they call the registry exam. And that's something that, you have to have in most of your health careers, whether it be with nurses, doing their board exam, respiratory techs, myself included, that you do have to complete to get your certification to become an RCT, or a registered cardiovascular tech.
So is there a required number of years of work experience that you need before you can write that exam, or is there more of a written and test aspect of that?
Yeah. So again, going back to the program briefly, you have to complete obviously the program itself within the 2 years that you're there, as well as successfully complete all aspects of the clinical rotation. So, students are being tested on their knowledge of interpretation. Can you identify, life-threatening arrhythmias? Can you identify heart blocks? Do you know the basics of patient etiquette or your ethics? Education. You're tested on the basics of medication, their side effects, their interactions, things like that. So all those requirements have to be met for you to be eligible to write this registry exam.
Very cool. So it's a balance of the practical skills and the practical aspect of the work, but also the theoretical, like you said, knowing the medication, the prescriptions, some of those root causes of issues and the treatment plans as well. Very cool. So what would you say is the most challenging part of your job? And then on the flip side as well, what is the most rewarding part of your job for someone that's wanting to get into the field and do what you do, but they're just not sure of the positives and the negatives?
Yeah, so let's start with maybe the more difficult question that you've answered or asked of the two here. The most challenging part of the career is not understanding, the patient's diagnosis, or essentially coming in. So a lot of the times, most of our patients are coming in with, some interaction with the vaccine, and that aspect of healthcare is still sort of, not really touched upon because it, might be a sensitive topic to a lot of physicians and also patients. But understanding that why these healthy patients who have, no family history, they don't smoke, they keep up with their exercise, they don't do any, recreational drug use, and why is it that they're feeling, these symptoms, or why are they coming in with myocarditis? And it does feel challenging at times because, you may find that you're providing all the answers that you can, trying to pinpoint the diagnosis, but sometimes it just doesn't add up. Sometimes you can feel palpitations or racing of your heart for absolutely no reason. And on the flip side of your question, the most rewarding part is seeing the, physiological change, the emotional change, their overall well-being improve, once they've had either a small procedure or once they've adapted to, proper lifestyle change, whether it be just as simple as taking a beta blocker or a medication to help lower their blood pressure. So definitely the positive change that these patients are coming in with, and seeing them continue those those tips that you provide them on their own in their everyday walk of life.
Now, for a negative aspect, right? This is something that I've just seen. It's played into people choosing their careers at all the time in the healthcare field. And would you say that there is a lot of difficulties working with physicians on certain cases, or are you one of those lucky few that have a good relationship with the physicians that you work with?
Yeah, so that's actually an interesting question there, Matt. My first job, where I worked in Cambridge as the rehab supervisor, it was tough to work with that particular physician, because some of the things that that may have been said in front of the patients were not necessarily the values or the beliefs that were taught in school, or what I personally believe in. But I have been fortunate enough currently in this position here in Guelph to work with somebody that is excellent at doing their job. They have fantastic bedside manners, and obviously working around a positive and healthy work environment will allow you to do your job, in a more proficient way.
Oh, that's good. That's good to know. Kind of leading on to that, what would you see the career avenues that you can take from where you're at right now? I know you touched a little bit about getting to the cath lab, but for the people listening on this, like this could be a stepping stone, right? I'm curious to know as to where the different avenues of career choices that you can choose from being in the position that you're at now.
That's a great question, Matt. I would say that one of the more obvious answers would be, if you wanted to go down the cardiologist route, you could go and pursue that avenue. Whether it be getting into med school and then doing your rotations, becoming a resident, which obviously we know is a lot of educational years down the road. If you wanted to completely go on the opposite, you could even go into kinesiology. You could go into the nursing aspect, as that kind of ties along with all the anatomical components of the body. So there is some outreach that can be pursued for somebody in my position, but it does continually have to be somewhat along the lines of the heart, or whether it be the lungs, as we know that those two organs work hand in hand with each other.
Understood. Now, do you feel like you need to become more specialized as you continue to choose these different avenues?
I've thought about that personally many times on my own, and currently I have to say that I really enjoy what I do. I love going into work and seeing these patients come in with changes in their life, or whether it be patients that have no clue what's going on with their overall health or their risk factors. So at some point, as I mentioned, I would like to pursue the cath lab route, but currently I just love my career on a day-to-day basis.
Very cool. Very cool. So some advice that you could give, some unspoken things that someone could definitely benefit from trying to get into this field. What would you recommend to them?
So, you hear the expression, or maybe the common theme is, listening to your parents. Your parents may sometimes have a larger influence on you as to what you would enjoy doing in your career. I actually, in high school and even my first year of college, I hated studying about the heart. I thought it was
Really?
extremely difficult. I had no passion for it. I didn't even want to know, the basic anatomical structure or why it's so important. But eventually, after doing the nursing career for a year, once I completed that exam, I just somehow found a spark, if you will, because we know that the number one leading cause in North America isn't I don't think it's cancer. It's actually cardiac disease. And cardiac disease is something that will affect probably somebody at one point or one aspect in their life. But there are so many tools that we have in today's generation with technology and medical advancement that you can do to essentially stay on the preventative side rather than the treatment side, which is sort of the last step.
Wow, I did not know that. So what kept you going through it then? I mean, to push something out for a whole year to have no interest in it, it's pretty remarkable in itself.
Yeah. So after that 1 year of nursing, as I mentioned, I did go back to school and picked up some grades. And it was at that 1 year of constantly working on the biology and chemistry that I found that, this particular subject, or this difficulty that I thought once was, unattainable in a sense of passing or getting through, isn't that difficult. And that the heart is such a remarkable muscle that it actually supplies itself with blood. It doesn't obviously just do one thing and pump blood to the rest of the vital organs and vessels, but it supplies itself, which I thought was one of the most unique things that I came across while doing my studies.
Okay. That's pretty
very
interesting.
cool. Yeah. So I guess to follow up on your point there, and initially, Thomas, you said you weren't interested in studying cardiology and the cardiovascular anatomy and things along that line, but eventually you found it to be your passion and is an important cause to pursue. So the advice I guess you would give to those listening is to pursue something you're interested in, even if it's not something that you thought initially was interesting, but also pursue something that's going to have an impact and make a difference on the lives of others. Is that right?
Exactly. So, you don't want to narrow yourself down to, maybe just one particular avenue, whether you're into arts or, even in the sense of healthcare. There's always room to branch out, and, don't be afraid to be uncomfortable. Even in my case, I was essentially terrified to study the heart because I found it so difficult in the beginning. But once I saw the beauty of, how the anatomy of the heart works and why it's so vital to, to the rest of our bodies, I took on that challenge, and 5 years down the road, here I am today enjoying my career. So never be afraid to get out of your comfort zone.
Yeah, that's great advice. Wanted to touch on the growth opportunities or the career opportunities a little bit more. So you said you live and work in Canada, in Ontario. Now, is there a difference between working in different provinces across Canada? Are there different requirements or certifications you need to work across Canada, and also tying that into the United States? I know most of our listeners are probably listening from North America. So, how would you, or what advice would you give to someone that's maybe living in the United States or across Canada?
I'm also curious, before you answer that, what is the pay reflective of in working in different provinces? So a double-edged question for you, Thomas. I'm curious to know if different provinces obviously offer different pay structures, but what could someone expect to make, like a range, working from all the way from the East Coast to the West Cost?
Okay, so I'll kind of touch base on Daniel's question there first about the opportunities to work in different provinces. That doesn't change across the board, in a sense that as long as you pass your program and you do have that certification from the CSCT, you can work anywhere within the country. Now, the further west you go, there is more of a demand for technologists out there. I just read the other week that Manitoba in particular is struggling to keep up with hiring these technologists, and they're actually referring to nurses and even other technologists, whether it be those drawing blood, to actually teach them the basics of doing an electrocardiogram or an ECG for sure. So in Ontario, I would say the average pay grade is anywhere from maybe $40,000 to $55,000, and obviously a little bit more if you do get a chance to work in a hospital, as they do provide benefits and even some retirement savings. But out west, the average pay grade is anywhere from $60,000 to possibly even $80,000 yearly.
Wow.
So that's really driven, like you said, by the demand, and I'm trying to articulate why, but it's probably because of the older population and the more remote population. So they're looking for those skilled healthcare professionals and technicians, and the demand is there.
Right, and another thing to maybe kind of dive off a little bit here is, in particular in Ontario, the last year, unfortunately, the province has let go of 30,000 nurses, which is just a staggering amount. So these nurses are no longer working, or maybe not able to find work, due to the pandemic that we've been struggling through. But there is always a need for technologists, because that is a very niche field, and there are other healthcare professionals that can do what we do in a smaller sense of maybe just helping out with prepping patients for tests or doing ECGs. But you really are a one-man niche. You've gone to school for 2 years straight to specifically study the electrical system of the heart, the mechanical issues. Interpretation is probably one of the most important critical skills that you have to have essentially patented down to do your career well. Because if you come in and you see something life-threatening and you're not able to identify it, that patient could be on track to something more life-threatening and potentially irreversible.
Wow. Yeah, that's quite a lot.
It's a very interesting structure, Daniel and Thomas. Like that's Daniel. I think it's very different for us here in America, right? We don't have universal healthcare, so being privatized, I'm sure there's a even bigger swing when it comes to working on the East and West Coast. But that's really interesting. I had no idea that 30,000 nurses have been laid off. That's news to me.
Yeah, it's pretty shocking.
So you talked a little bit about the critical assessment skills that you need. What else do you think would make someone successful in this role? You know, what are some of those soft skills and maybe personality traits, confidence, things like that? Obviously, being able to communicate with your patients and your supervisors and the other health physicians. So talk us a little bit about some of those skills and traits that would make someone successful in this role, and maybe, you know, how you develop those skills along the way.
For sure. So, you know, it all kind of stems down to, you know, being essentially pushed into that nursing field in my first year. You know, the first 5 minutes of you walking into a room and meeting somebody new can kind of generally give them a sense of who you are, you know, your confidence level, you know, what type of care you may provide them, how patient you are. And so, you know, working with these patients in long-term settings in the hospital in the very beginning of my career, who were kind of on their, you know, their end of their life, if you will, really taught you the importance of compassion, right? Because you're more likely to get, you know, more sensitive information from a particular patient, or maybe something that they don't quite feel comfortable sharing, but that would help you in your diagnosis by being more patient and more kind. And, you know, so definitely communication by far would be top of the list. And just having, you know, a softer approach. You know, imagine you being in the patient's shoes and you're coming in with a million questions that you were too scared to answer, whether it be for fear of being judged for, you know, their lifestyle, or maybe their weight, or maybe things that they do that they shouldn't be doing. So it is important, like you mentioned, to have those soft skills, as you know, as well as educating yourself on, you know, some of those questions that they might have that you should have an answer to, whether it be, you know, in regards to medication, or the biggest one is just lifestyle aspect. You know, what am I doing today that hasn't been working in the last 5 years? How can we come to a resolution that would apply to me personally and, you know, give me that change that I'm looking for?
Yeah, no, I think that really explains it, and I'm sure our listeners can take away a lot of the things you said, and work on maybe some of those traits and skills along the way before making that decision to get there.
I am curious though. Sorry to interrupt, Daniel.
Go ahead.
I am very curious. Would you say that in any sense that you haven't, this is for Thomas, lost like that sense of compassion, right? Being associated with it all day long. I have plenty of friends that work in the ICU that just see horrific things, and these things no longer faze them. And it's hard for them to kind of emotionally internalize that. So has this job and this career path kind of shaped you in a different way in internalizing those emotional responses that you might have?
Yeah, so that's actually a great question, Matt. I would say that on a personal level, if I'm, you know, doing some honest reflecting, it has made me become more patient overall with just people in general. So whether I'm interacting with somebody, you know, at a grocery store, or even the most difficult of patients that may come in and, you know, use profanity because they're just frustrated with their life, or they know that there's nothing that can be done, no matter, you know, what treatment you give them, you know, what medication, what therapy. You know, some things are just irreversible. Like, for example, congestive heart failure. That's one of the things that there is no cure for. If you have this disease, you know, the aspect is just quality of life. And so I wouldn't say that I'm necessarily, you know, desensitized or sort of, you know, hindered from expressing that even outside of a clinical setting, but it does make you, you know, kind of think twice before saying something, because, you know, you don't know what that person may be going through. And, you know, even just a touch of kindness or compassion can go a long way.
Yeah, that's great to know.
All right, I think we're down to our final question here, Thomas. Thanks for being so patient with us and giving away you know, all the industry knowledge and your experiences to our listeners as well. So our final question is, if you could do it all over again, would you? Or would you do something different?
Absolutely. I think, you know, given what I know now and, having that foot in through the front door, if you will, it's made me realize that the demand for healthcare in general will continuously be high. Unfortunately, our bodies down the road are susceptible to, some type of wear or tear, or, whatever it might be. And so I would encourage, maybe some of these listeners who, have some small spark, whether it be, they're interested in testing, or they're interested in, saving lives, or, saving the lives of animals, or whatever the case might be. There's always a demand, and the reward far out exceeds, maybe some of those small negatives that I mentioned that you might face on a day-to-day basis.
All right. That's awesome.
Great.
I think we can take away a lot from that and from our conversation here today. Well, Thomas,
Absolutely. Yeah.
Thomas, we thank you so much for your time today. And we hope our listeners have learned something. Maybe this will be, the spark that helps them make that decision and take that first step into the medical field, and particularly in cardiology or cardiovascular technology, as Thomas is here today. So we appreciate your time, Thomas. Thank you so much. And we hope everyone listening has a great day.
Thank you guys as well. I appreciate you having me on.
Sounds great. Thanks, guys.